Dr. Pedro Ramos from the Portugal. Dr. Ramos is the Director de Service de Ancia Hospital at the Portugal. Dr. Ramos will talk on the knowledge and training as the essential. The ocean is not a problem. For the same thing, the reactor for this session will be Dr. Razman Jarmin. Dr. Razman Jarmin is an astute surgeon and he is the chair of the 3rd Congress of Asian Collaboration for Trauma. He is also a hospital director of the Hospital Consular Tunku Murkis, Tang, Kuala Lumpur, Malaysia. Please welcome Dr. Razman Jarmin.
As I told you, we live in a small island in the Atlantic Ocean with 250,000 people. The capital is Funchal. I would like to take the opportunity to pay tribute to Vijay Apazami. He was with us in 2010 in the first DSTC that I organized here in Madeira with the Portuguese Surgical Society. And I take the opportunity to pay a tribute to Vijay, a great colleague, and that he teaches us very much. It's a real pleasure to share with you what we have done here in Madeira in the last 20 years. With Tercio, we and Civil, with Tarek Hazek, he came to Madeira too, and Tercio, and to the others reactors that are in this conference. I'm a general surgeon. I was involved with the pre-hospital system, with the quality program of my hospital, and I'm instructor in all the trauma, emergency, and catastrophe course that I know so far, the ATLS, the ATCN, the DSTC, the USEC, the FAST, the FAST, and I will show you the one that we were very much involved in the last years. It was the medical response to major incidents and disaster with the mentor of Dr. Stan Lindqvist from Sweden. As I told you, I was involved with the pre-hospital system, with the Portuguese Surgical Society, running the chapter of trauma, and with oncology, with breast cancer and melanoma cancer also. Additionally, we started the program of Simulation Clinical Center in our hospital 2012. We are going to perform 10 years of course in Madeira. In surgical, medical, intensive care, neurocritical patient, primary care, continued care, and we already performed 452 courses since 2012, 3,000 hours of training, and we reach 7,000 health professionals of our healthcare system from Madeira, the other island, Azores, and from Portugal mainland. This is my hospital. It's a hospital with accreditation, with the CASP healthcare knowledge system, and we already had another accreditation right now from the Portuguese society, that is the evaluation of the Andalusia system. This is our primary care, our organization, 250,000 people. We have healthcare centers around the island, and in the other island that is far of 40 miles from Madeira, it has 5,000 people. Our secondary care, it's a hospital with almost 800 beds. Hospital Central do Funchal is for surgical problems. Marmoleiros is for medical problems, but we already have more than 50 specialties: emergency department, pediatric, obstetric, hemodynamic, neuronavigation, hyperbaric chamber, nuclear medicine, radiotherapy, ambulatory surgery, physical medicine, day hospital procedures, pathology, blood and transfusion, pain medicine, and dialysis. And we have 7 OR for normal surgery and 4 OR for ambulatory surgery. Our program, it was an intensive program since 2004 with education, using the diagnostic means, teaching, training, some knowledge about organization, about planification of our response for specific situations. we cannot do this work alone, so we have the collaboration of societies and all countries all over the world, the Karolinska Institute, the Royal College of Surgeons, the UTREC, the SBIT in Brazil, the Santa Casa da Misericórdia de São Paulo, University of Miami, with the collaboration of Mauricio Dean, and then TalkSeg, the hospital where I had the opportunity, with the invitation of Shu, to collaborate on the DSTC course in 2016. We just want to, the goal was almost put the right patient in the right place in the right time. That is our goal with our education program for our healthcare professionals. Some issues: safety, medical assistance, security procedures, quality healthcare, teamwork, education, training, differentiation, communication, simulation, command and control, and assessment was the goals that are always present in our training course and our education program, with the structure of command and control and assessment, communication, security and safety, and triage, treatment and transport when we need to respond to specific situations. This is a program that involved the health care system and involved the civil protection in Madeira. This is the last 120 participants in the MRMI medical response to major disaster in 2019. Has already told you, we was hit in the last 10 years for several situations. It was the floods that we have in 2010. Then we have the fall of a tree on the religion feast in August in 2018. We have the accident with the German tourist in 2019. And we have another image from the floods and image from what happened in 2010. The fires in 2012 and 2016. And finally, the fall of the rocks on the touristic walk that reach several people that are visiting this place. Our course, as you saw, involved lots of people, lots of professionals of our healthcare system, and we were always sorry. Okay. Of the course, we need to planification, to organization, education, formation, differentiation. All of these parameters will always involve in our education and training program. We have the support of the government since the beginning, and we were able to create, because we reached some experience, if we can say that, since 2010, and in 2016 we created the Madeira International Disaster Training Center, and we are performing all of this course all over the years since 2010 in Madeira, in Portugal, in Azores, and we are very much involved with this education program. Our mentor is Professor Stan Lenquist from Sweden, and we are related with MRMI and with the Eastern European Society for Trauma and Emergency Surgery. Specific attention when to respond to a major incident, a major accident that occurs in any land, and there is a plan that they need to be followed. And we need to learn, even in a critical situation, to save more lives. This is the transportation. Regional Command Center. Rescue Officer Command. And we have briefings and debriefings after the exercise. This one was made during the pandemic situation in Almada, in the middle of Portugal. So the participants were tested and using masks. It was not a problem. So that's it. My good friends, I finished my presentation, inviting you to come to Madeira. Madeira Island belongs to all. Thank you for Asian Collaboration for Trauma. And I'm inviting you because Madeira is the island of the best player, football player in the world, Cristiano Ronaldo. So thank you again.
Thank you, sir. May I request Dr. Razman to react as a reactor? Dr. Razman, sir, please.
Thank you, Jarmin. Thank you, Dr. Pedro, for a very, I would say, important presentation, because I think based on the last 20 minutes of the presentation, I think had shown how your commitment and your efforts in developing the trauma and disaster management, especially in the island of Madeira, Portugal. I believe, based on the presentation that you have presented, how the self-sustainable of Madeira medical services in supporting the service, especially in trauma, and with your experience of fire, floods, and accident, where I believe probably the support from the mainland may be a bit technically time-consuming. I think that's maybe the reason why I think the development of well-established trauma services and disaster management are well-equipped. I'm really glad that I think you're willing to share with us those information, those experience, and I'm sure, especially our friends here in Asia country, would like to learn a lot on how you organize this. I think with 12 years experience that you have performed, it shows that the development of I would say the local setting had led to international courses, international disaster training centers that had been made a recognition, not only in Europe, perhaps in the world itself. And the other thing that I noticed about your presentations is that how you utilize the simulation training, which I think that's very important, especially in trauma and disaster management. Because I think preparation is very important. Having a simulation training is also equip us with readiness and preparedness at any point of time. Because whenever the time comes, then we are ready to endeavor or to face this situation. And I think the collaboration that you have locally and internationally have been well recognized based on the submission of your presentation. And the other very peculiar situation that might interest me, because I think being the hospital director myself, sometimes it's challenging, especially in the era of COVID, where you integrate the disaster management theory and practical into handling of COVID-19, like managing the COVID-19 patients and then organizing the vaccination programs. Those are the parts of, I would say, how you utilize your disaster management skills towards the COVID-19 care. And I'm sure with your experience, with your knowledge and your dedicated team, you can handle any form of disaster, either in Madeira, in Portugal, or even in Europe itself. I would like to congratulate your effort and collaboration. And finally, how I wish that I'm able to visit your center and learn more from you, especially joining your internationals or your disaster management program for us to learn more. Thank you very much for a very knowledgeable presentation. Thank you, Dr. Pedro.
Thank you, Dr. Razman, for your kind words. It has been a hard work for 10 years, and but our clinical simulation center and all the knowledge and the training that we perform with the collaboration of the national, international societies can help us to respond to every situation that we need to face in the last 10 years. Thank you very much.
And I believe that this also can be shared with us, especially among Asian countries where certain countries may have adequate resources as compared to other countries, and setting up what we call regional training centers, like what you have, also helps to improve or also to enhance especially the simulation in trauma training itself. This is something that we can learn from you. Thank you very much.
Okay, thank you. Thank you very much, Dr. Razman.